So whenever the letter is being written to the physiotherapist, okay, and from your medical knowledge or from your clinical experience, you know that physiotherapists deal only with a certain aspect. They are not responsible for administration of medication. They are not responsible for making diagnosis as such. So they are responsible mainly for the mobility issues, or if there are any issues with the patient's muscles, bones, or tissues. And that is how such letters are to be written. So here very clearly it states it is for the patient's mobility. Now look at the case notes. So here it's given the patient is Mr. Arthur Branson, 63-year-old married man. He was admitted on 16th Jan and discharged on 19th Feb. Most of the students look at admission and discharge date just as if they are the numbers. Okay, don't look at them as just the numbers. They can give you a very clear hint about the patient's progress, right? If, say, for example, if somebody has an operation and if they are discharged within 10 days, 15 days, that indicates it is a routine recovery. But if you can see a long duration of hospitalization, so that gives you a little hint that, maybe there might be some issues, and that is why the longer hospitalization. So don't look at them as just numbers. See how long was the duration of hospitalization. Okay, that's exactly why we have a selection of information criteria in place where we look at the clear timeline of hospitalization. Then the hospital where the patient was admitted. What was the diagnosis? Fractured left patella, grazing, and laceration. And the patient is allergic to penicillin. Medical background, why was the patient admitted? So it's given that they had a fractured left patella. How did they get it? Because of an accident. When they came to the hospital, there was severe pain. They were not able to bear any weight, nil weight bearing. Okay, so that means they were not able to bear any weight on their log. Okay, and the morphine that was given, you have got the physical examination result, you have got the x-ray reports, and what was done for that is the surgery. And then there is some information given about the patient's past medical issues. So from that, if you can see the appendectomy, but that was a long back. Okay, this letter is being written in 2018, and this is maybe at the younger age, and then it has no direct connection with the patient's current condition. Then the arthroscopy that was done, but there is no result given. Okay, arthroscopy is usually investigation. So there's no result given. So if won't make major difference whether you write it or not. And again about hypertension, maybe you can mention it as a disease condition, but then again, as I told you earlier, uh, they are not responsible for medication administration. So you can skip certain things, right? You can skip those things here. Look at the patient's social history. Now, our selection of information criteria says include social history only if it is a risk factor, include social history only if it has impact on the discharge plan. Here it is given that they have auto part business and they are staying with their family, right? Lives with wife in Orange and has 2 children and they have their own business. So if you look at the social history, there are no risk factors as such. It doesn't say that their house is, a 2-story house where it can be issue for them as a mobility. Okay, yeah, I'm sorry for the inconvenience. Yeah, so the social history here is not causing any impact on the patient's current condition. Then, if you look at the patient's medical progress, so you can find some uh, clear words here. So here we can see a very clear hint, and we had also seen this point in the admission and discharge part. Okay, so it says slow progress. Now, why slow progress? Right? Now, whenever a patient has a surgery and if they have a slow progress, there can be many reasons for that. One reason can be that they had a lot of complications after that. One reason can be there were infections which took them a while to recover from those infections, and those can be the reasons for delay in their recovery. But here you can clearly see that slow progress due to lack of motivation. So there were no complications as such. It is just that the patient is not motivated enough. And then it clearly says full recovery expected. So this also rules out any long-term issue. Okay, it is also possible sometimes that uh, maybe because of any issues with the implant that they have done, or there are any technical issues with that, then that can also be one of the reasons. But here it clearly states that full recovery expected. That means not the technical issue as well. Now, what is happening because of this? He requires one person assist with activity of daily living. Lack of motivation was one issue. Another is hesitant with crutches. Whenever a patient undergoes operation for lower extremities, then initially to avoid weight on that affected joint, we provide them with crutches so that the weight bearing can be prevented. We can prevent exertion or weight on the affected limb. But he's not willing, he's hesitant. Okay. Then he's quietly spoken, he's concerned about loss of income. Wife is also anxious about the accident. Now, these are the emotional and social issues. Now, when it comes to the emotional issues, we don't need to get into much detail of it for physiotherapists, but yes, we must state clearly as to how is the patient's emotional status. Because if the patient is nervous, if they are someone who is hesitating, it can be very difficult for the physiotherapist to actually provide assistance. Because basically, if the physiotherapist has to make him walk with crutches, so it is the patient who has to do, right? So if the patient is not in a good mood, if the patient is someone who is very reluctant to do things, if they are nervous about it, depressed, then that would affect their progress. So whenever you are writing to a physiotherapist, if there is anything given about the patient's emotional issue, provide a brief overview. There's no need to write everything as it is, like concerned about the income or the wife's anxiety, but uh, it is important to say that he lacks motivation, and he's not willing to use crutches, because those are the reasons why he even after 1.5 month or almost a month after accident, he's still not able to do activities on his own. Then again, further information about his medical progress. So it says that the physio assessed the range of motion, and it is 2/5 power. In the third session, it improved to 3/5. So this is the current status. Okay, so the actual power in the hand, in the leg should be 5, but this patient has only 3 power in the left leg. And the left leg is only affected, so obviously it is about that. He's still not using crutches properly. He still lacks motivation. Okay. We have given reference to occupational therapist for modification, and we have provided a knee splint. Now, what is the physiotherapist supposed to do? So that is given in the discharge plan. Now, when you look at the discharge plan, don't think that everything that is there in the discharge plan is to be requested to that person. Look at carefully who is supposed to do what. So here it is given local physiotherapist to be arranged for 2 visits per week for 6 weeks. So here it says local physiotherapist to be arranged. So who is going to arrange? We are going to arrange, and that is why we are writing this letter to a local physiotherapist. So we have to request that they visit twice in a week for 6 weeks. So do not convert this into a sentence saying please refer him to a local physiotherapist, because you are writing to a local physiotherapist, right? And you are arranging it. Then it says further physiotherapy requirement to be assessed on 6 weeks appointment with surgeon. Physio to liars. So see, very, very clearly it is given what the physio has to do. One thing the physio has to do is 2 visits for 6 weeks. Second thing they have to do is they have to liaise with surgeon for further instruction. So for 6 weeks they have to provide, and after 6 weeks they have to liaise with the surgeon for whether the further requirement is there or not. So these are the 2 things the physio has to do. See, this is for the OT. Okay, this is follow-up appointment has been already booked, but 6-week appointment is still to be arranged, and that again doesn't say it is the physio. Then very clearly given, patient's general practitioner already notified for monitoring medication. Okay? So it is again not the physio who has to do this. So even if you don't know how to write to a particular health professional, okay, what you can do is Again, look at the case notes, read the case notes very, very carefully, and select the information appropriately. Now, if I get the selection of information handout here, if you have it, you can open it for yourself. I'm just bringing it on the screen. So provide contextual information, because when we are introducing the patient, we need to provide the background. So contextual information, then include a brief summary of main diagnosis, initial condition, or presentation. So there is a lot of detail given in this case notes about how the patient had this accident, and what was his pain level on admission, and it gives information about what medications were given to him, what did the x-ray suggest, and then finally the operation. But whenever you have such task where you are requesting post-operative follow-up, okay, when you are requesting follow-up for the patient who is going home after operation, more focus has to be given up for his progress after the operation, rather than writing too much about the condition before the operation. Because yeah, of course he had pain, and of course he had those issues, but for that reason we have performed the surgery. So that's no longer the issue now. The issue now is, what are the issues, what are the problems that he still has after the operation, and what do we want the other person to do about it. So main focus has to be on current condition, not too much. And that is why I have used the word brief summary. Okay, so that has to be a very short summary. Be aware of timeline. Okay, when was the operation done, when he was admitted. And more importantly, focus on current condition. Instead of saying what was his pain level on admission, it is better to say what is his pain level now. Look at the case notes, see if the patient's condition is progressing or deteriorating. Include the role of other health professionals, okay, in upcoming appointment and ongoing treatment. So here the physiotherapist role is important, because we are writing to the physiotherapist. Okay? And it says only include, that means don't include otherwise. Only include social history if it is a risk factor of illness, if it has any impact on discharge plan, or if it is writing a letter to a social worker or psychologist, only then the social history. Okay, so here the social history has no impact on the discharge plan as such. So this is how the information is to be selected. So now let me bring the model task on screen. So the initials remain the same, there is no difference. But the way we write introduction paragraph will be slightly different. Here we are not requesting ongoing care and monitoring, but we are requesting physiotherapy. So I'm writing to refer this patient who underwent open reduction internal fixation surgery in the view of a fractured left patella. So this is a very good phrase that you can use to provide background of something. Okay, why open reduction and internal fixation? Because of a fractured left patella. Though his overall progress has been satisfactory, he requires ongoing physiotherapy in order to improve. Okay, in order to is used whenever you want to cite purpose for something, and it has to be followed by verb. So improve his mobility and independence. So this is how your introduction paragraph can be when writing to the physiotherapist. Now, because we have already mentioned about the operation in the first paragraph, I did not include anything about the accident as such because my focus is mainly on the post-operative situation. I have mentioned the diagnosis very clearly though. Yeah, I have mentioned the diagnosis clearly. Why open reduction and fixation? Because of a fractured left patella. So usually with body organ we use article the. So left patella, I should write the, but here I am mentioning it as a symptom of fractured left patella. It is mentioned as a symptom, and that is why I haven't, and I'm mentioning that fractured left patella for the first time. So that is why I have written a fractured left patella instead of writing the fractured left patella. Okay. Now about the post-operative progress. So Mr. Branson progressed slowly, largely due to lack of motivation to perform the necessary exercises, as well as anxiety when using crutches. Right? So two reasons, due to, and due to is always followed by verb, it is always followed by nouns. Okay, so due to lack of motivation is a noun phrase to perform the necessary exercises, and anxiety is also a noun when using crutches. He required one-person assistance with the activity of daily living. However, in his most recent hospital physiotherapy session, power in his left leg was 3/5, showing some improvement. So there has been some improvement in his situation, specifically in the power. Then there is a brief summary of his medical issues. So in terms of medical history, has had, if we use present perfect tense for ongoing conditions, but is otherwise healthy. So there are no other health issues. He had a right knee arthroscopy in 2006. His current medication are monitored by his general practitioner. So I have not mentioned the dosage and those things, but what medication he's taking, because when it comes to physiotherapy, a person is less likely to perform exercises if they have pain, and therefore analgesics and anti-inflammatories are the medications which physiotherapists do deal with. They need to provide those medications to their patient if the patient has pain, but here the patient is already taking. So that is why I have framed such a sentence where I have mentioned that it is monitored by his general practitioner. So it gives a clear indication that the physiotherapist doesn't need to do anything about it. It is just for his information that he's taking this medication. Okay? So that is why I framed one single sentence saying that they are monitored by his GP. And finally, the request. Okay. So in view of the above, Mr. Branson requires 2 appointments per week for 6 weeks, with the need for further treatment to be determined by his surgeon upon completion. So for 6 weeks, they are supposed to complete it, and after that, the further need is to be determined, to be decided by his surgeon. Okay, usually with any professional we write a, but here we are not writing any random surgeon. They have to have the appointment with this patient's surgeon who performed this operation. So that is why I have said his surgeon. I'd appreciate if you could liaise with the surgeon. Here I say the surgeon, okay, with his surgeon, regarding any additional requirements thereafter. So thereafter means after that period of time. So 6 weeks I have already given here. So after that. And just to brief them that occupational therapist has been arranged. With your ongoing assistance, Mr. Branson is expected to make a full recovery. Please note, a knee splint has been provided to him. Right, so this is how the letter to a physiotherapist is written, where more focus is on the patient's mobility and what are we expecting the physio to do, rather than giving emphasis on too much emphasis on the medication and those things. So this letter is very much there in the nursing PDF. Okay, and I would want this is letter number 9, and I would want all of you to write letter number 10 from the nursing PDF as an assignment, which is again writing to the physio. Okay. So here we are almost done with all the types of letters that one can have in the nursing writing or in the medicine writing. So this month's cycle we end here, and those students who are going for the 6th April exam, on Friday I'll be only inviting those students who are going for the 6th April exam, because we'll have the review session on Friday, and from Monday onwards we'll start a fresh bunch. So from Monday onwards we'll commence the regular sessions. So this Friday, the session will be only for those students who are attending the exam on 6th April. And for rest of you, those who are planning for the May exam, will commence a fresh sessions from Monday onwards. So I'll end the session here, and for rest of you, I'll see you on Monday, and for the 6th April candidates, we'll have the session on Friday, but Friday would be mainly the question answer session. So keep your questions ready, keep your queries ready. The last minute preparation, if you have any last minute questions, keep them ready, and we'll be discussing all of them in the Friday session.